This month is Prostate Cancer Awareness Month. This type of cancer is the second leading cause of death in men. A major reason to raise awareness is because this cancer may not show signs or symptoms in the earliest stages. So joining us now in our discussion, our 9 News medical expert, Dr. Payal Kohli. This is something that lots of times Breast Cancer Month comes along and people say, what did you do for prostate cancer awareness? And it's because we don't talk about it enough.
We don't talk about it enough. And there's
what does the prostate do?
So it's a little gland about the size of a walnut. And when men have their reproductive years, it's involved in, the semen that's created. But after reproductive years, it just causes trouble. So it can get enlarged and you can get something called benign prostatic hypertrophy, or you could grow a little cancer in there. And because it's so hard to sort of get to the gland, reach it and assess it, that cancer could have no symptoms and still be growing.
Is that all it does? Should it be removed after you reach a certain age?
I mean, that's an interesting thought. It doesn't really have much of a function after men have sort of stop being reproductively active. And so it's interesting because they're looking at a lot of studies that shrink the prostate, medicines that shrink the prostate, whether those would protect you against prostate cancer. So men who have enlarged prostates get on these medicines, they could actually potentially have a lower risk. I don't think you should go in and have it removed because it's a big surgery.
Right.
It's kind of in there and it's a bloody surgery.
I've seen it from knowing men who've had to have it removed or have parts of it removed.
And you can have erectile dysfunction afterwards. You can have issues with
incontinence.
A lot
of complications.
So it's a big deal.
Yeah.
So we don't just take it out, but in terms of checking it, making sure that it doesn't sneak up on us, I think that's really important because PSA screening, which is how we would check it, blood test, used to be really trendy. And then all this confusion came out about should we be doing PSA screening? And that's confused people to the point where we're now missing more prostate cancers and diagnosing them more later in
the digital exam used to be, the big part of your annual physical, but that seems to have gone by the boards now.
That has, and if you think about it, the digital rectal exam where you put a finger in the rectum to try to palpate or feel the prostate only checks part of the prostate and also only checks once the tumor has gotten big enough to be felt. A lot of times prostate cancer can be microscopic and most prostate cancers are slow growing. There are subsets that are faster growing, but if you can't feel it with your finger, you don't know it's there, it's really not a very sensitive test. So you're missing a lot of cancers. And by the time you start feeling it with your finger, it's almost too late.
The PSA is effective? That is the best way at this point?
I am a fan of PSA testing, Tom. There is a lot of controversy in the medical literature. Are we getting too many false positives? Because even if the prostate just grows from BPH, benign prostatic hypertrophy, it causes that PSA to go up. If you have a urine infection, it can go up. Certain medicines can cause it to go up. So you get false positives with it. But I think the combination of PSA testing early and aggressively and MRI of the prostate, which is now a new tool in our toolbox, really does prevent, unnecessary biopsies, but make sure that we're picking up cancers that are growing.
And it's sort of like breast cancer, there's some disparities here. When we talk about certain men are being diagnosed at later stages and dying from prostate cancer.
Right, so black men in particular, 1.7 times more likely to get diagnosed and twice as likely to die. And part of that we think is the mistrust of the medical system, but a huge part of that is this lack of screening. We're not checking them often enough. And if you're black, you've got a target sign on you when it comes to prostate cancer, and you really should start screening a lot earlier than everybody else. So I would say 40 to 45 for black men, or if you have a family history, perhaps even earlier. But for the average man, 45 to 50, talk to your doctor about the PSA. There's also a test called the free PSA, which helps us to kind of be smarter in how we interpret the PSA, and with or without a prostate MRI if it comes out elevated. And so now we can have our cake and eat it too, because we're not missing these slow-growing cancers, and at the same time, we're not biopsying you unnecessarily if the MRI kind of leads us one way or the other.
You say slow-growing cancer. This was one of those cancers that they said you die with, not from.
We used to say that. And now what we're finding, especially in younger men, we're finding more aggressive prostate cancers for reasons we don't understand. But there's two sort of subtypes. Majority of them you die with, not from. But that also if you get diagnosed when you're 85 or 90. But if you're getting diagnosed in your 50s, it's going to catch up to you. It can spread to your bones, to your brain, and really cause trouble.
Well, this is part of the awareness of Prostate Cancer Awareness Month. So thanks for shedding some light on it. As always, Dr. Payal Kohli, thanks. Of course, you can find more with Dr. Kohli at 9news.com/Dr. Kohli.